Welcome, everyone. In this explainer, we are focusing on one of the most critical skills in all of patient care, respiratory assessment. Getting this right isn't just about checking a box. It can be the very first step in saving someone's life.
Okay, let's just dive right in with a super important question, one that every single healthcare provider needs to have ready in their mind. When a patient starts to go downhill, what's usually the very first sign? Just think about it for a second. Of all the vital signs, which one tends to wave that first subtle little red flag?
And the answer? Well, it's deceptively simple, but it's incredibly powerful. Often, way before the blood pressure tanks or the heart rate goes wild, a change in a patient's breathing is that first clue that something's really wrong. And hey, this isn't just a hunch we have in the field. It's a well-established medical fact. The respiratory rate is called a priority escalation vital sign for a very good reason. Mastering how to assess it is truly a cornerstone of patient safety.
So, before we can get an accurate assessment, we need to be totally clear on what exactly we're even measuring. Let's make sure we're all on the same page with the basic definition.
Here's the key thing you have to lock in. We're not just counting when the chest rises. One breath, one respiration is one complete cycle. That's one full breath in and one full breath out. That whole sequence, that's one.
All right, so now we know what we're counting. The next step is understanding what we're looking for. What are the normal ranges? And maybe more importantly, which numbers should make our ears perk up?
Now this is really fascinating, and it's so important. Look at how dramatically the normal rate changes with age. An infant breathing 50 times a minute? Totally normal. But that exact same rate in an adult? Well, that's a huge emergency. You've got to memorize these ranges. They are your baseline for every single patient.
So you're basically on the lookout for two main problems. On one side, you've got tachypnea. That's breathing that's way too fast. It's often the body trying desperately to get more oxygen. On the other side, you have bradypnea, breathing that's dangerously slow, which can be a serious sign of something like a central nervous system issue.
Okay, we've got the what and the why down. So now let's get into the how. How do we actually get a truly accurate count? This is a skill that takes good technique and, honestly, a little bit of cleverness.
These 4 steps, they're totally non-negotiable if you want an accurate reading. First, hand hygiene. That protects you and the patient. Second, position them upright. This lets their lungs fully expand, which gives you a true count. Third, and this is key, you've got to be sneaky. The second you tell someone you're watching them breathe, they'll change how they do it. And finally, always count for a full 60 seconds. It's the only way to catch irregular patterns.
And here it is. This is the single best pro tip for getting that discrete count. When you finish taking their pulse, don't move your hand. Just leave your fingers on their wrist, but shift your eyes to their chest. The patient has no idea. They just think you're still focused on their pulse. It works like a charm, every time.
Getting an accurate count is absolutely the first step, but it's really only half the story. A truly skilled assessment means you're using your eyes and your ears to figure out the quality of the breathing, not just the quantity.
This is really where you level up from just being a data collector to being a true clinician. You're observing the story the patient's body is telling you about how hard it's working just to get air.
So, as you're counting, just run through this little checklist in your head. You've already got the rate. Now ask yourself, is the rhythm steady? Is the depth of each breath nice and full, or is it worryingly shallow? And maybe the most important one, what's the effort? Does breathing look easy for them, or does it look like hard work?
And this image right here shows you exactly what that hard work looks like. We call this using accessory muscles. See how the muscles in the neck or between the ribs are getting sucked in? Those are retractions. Or notice the nostrils flaring out with each breath. These are unmistakable signs that the body is struggling for air.
And the alarm bells don't stop there. Cyanosis, that bluish color on the lips or skin, is a very late, very serious sign. Listen for noises. Can you hear grunting or wheezing? Try asking them a question. Can they get a full sentence out, or do they have to stop and gasp for breath? All of these are urgent findings.
Okay, you've used your skills, you've gathered all this crucial information. So now what? What is your final and arguably most important professional responsibility?
I really can't stress this enough. Your job does not end when you get a number. In fact, the most critical part is just starting. It's what you do with that information that can truly change a patient's outcome.
First, let's talk numbers. If you get a respiratory rate on an adult that's higher than 24, that's an immediate report. Don't wait. Don't second-guess yourself. You escalate it.
And the same is true for the other end of the spectrum.
An adult breathing less than 10 times a minute is an emergency. That needs to be reported to the nurse right away.
And please remember, it is not just about the numbers. Any of those signs of distress we just covered, labored breathing, retractions, cyanosis, they are every bit as urgent as an abnormal number. Also, a sudden change from what's normal for that specific patient, that's a huge red flag that needs immediate reporting.
And finally, you have to document everything. You've heard the saying, if it wasn't documented, it didn't happen. And be specific. Don't just write respirations 28. Write something like respirations 28, labored, with shallow depth and irregular rhythm. You've got to paint a clear picture for the next person.
So we'll end right where we began. By truly mastering this skill, by looking beyond the numbers and really understanding the story a patient's breathing is telling you, the answer to this question is, without a doubt, absolutely yes.